Hello, listeners, and welcome back to the Peggy Smedley Show. As always, I'm your host, Peggy Smedley. Too many healthcare workers are fighting to save lives without the basics: clean water, safe sanitation, and dependable energy. It's an overlooked crisis with enormous consequences. Today, I'm welcoming back Boris Martin, CEO of Engineers Without Borders USA, to talk about the engineering solutions, community partnerships, and the on-the-ground stories that are transforming care for millions. Boris, welcome to the show.
Thanks for having me again, Peggy, and thanks for talking about such an important issue. I really appreciate it.
Boris, I was doing a little bit of research, and it's really disheartening to think that we continue to talk about some of these basic needs that humanity has. And when we talk about infrastructure, water, energy, sanitation, we've been talking about it for some time now, but I want you to talk to my listeners and share some of the critical need that I just mentioned for water, sanitation, and why this is so critical, even just in healthcare facilities.
Yeah, thanks, Peggy. The question of, as you said, fair, equitable access to infrastructure, basic services like water, sanitation, energy are things that we hear about in the news seldom, actually. We kind of know it's there, but people don't pay that much attention to it, frankly. When it comes to health, on the other hand, if you look at the news right now, the hantavirus is coming up. And so when it comes to health, people understand that our realities and our lives are really interconnected. The pandemic, the COVID-19 pandemic really brought that to the surface. But in an ironic sense, when we think about health, oftentimes we think about the vaccines and the medicine. We don't think about the infrastructure that actually supports the healthcare delivery. And for a very long time, the world assumed, especially development partners and international funders, assume that if you talk about a healthcare facility, it's got to have water, it's got to have sanitation, it's got to have electricity because it's a healthcare facility. And there was a landmark assessment in 2015 by the World Health Organization that actually showed that in the low-income countries of the world, in fact, the picture is very different from that. Almost 40% of healthcare facilities lack basic water services, meaning that if you're going to a healthcare facility to give birth, I've heard of stories of women having to bring 2 buckets of water as they're pregnant and going to the clinic because that's their water allotment for giving birth. 80%, that's probably even worse, like access to basic sanitation services, and that you're talking about a place to go to the restroom, right? So those are the things that in the West we tend to take for granted. There is such a thing as healthcare associated infections. It's HAI, it's an acronym. And when there's an acronym behind it, you know that it's something that actually happens more than it needs to or than it should. And it all relates at the end of the day to keeping people healthy, keeping everyone safe. And so for Engineers Without Borders USA, the world of the discovery and the connection that we've had with this world of improving the healthcare facilities themselves is about 10, 15 years old. And we responded to requests from communities that said
Boris, let me interrupt you. We have some really smart people. We have some really smart technology. We talk about AI. We talk about all this stuff every single day on this show. You're telling me we're at an alarming point that we can't do something to change what's happening here? It's disturbing. I'm sorry about the emotion I'm getting here, but it's frustrating to hear. And you probably have way more frustration than I do. But we all talk about all this great tech, but we can't do more to solve some of this.
Yeah, there's a lot we can do. I would say someone said to me recently, people who show up to a healthcare facility, especially those healthcare facilities that we're talking about, right? Like in rural areas of low-income countries, not only are they poor, but they're also sick, which means that they're basically the most vulnerable people on this planet. It's impossible for them to advocate for themselves. And I think that really is a reason why this problem has remained silent. It's like communities are not proud when their healthcare facility they have is derelict, doesn't have electricity, is dirty and poorly run. Medical equipment is lying broken, unused in those places. And so it's been like a bit of a shameful shameful problem. And it's not just shameful for these communities, it's shameful for humanity. As you describe, it's outrageous that we're still there, right?
So we're a world that cares only about things as it impacts us. So unless we're impacted, we just say we're going to ignore what's happening around us. And I guess I want you to share some real examples, because maybe if we could talk about how do we improve this infrastructure? How are we dramatically changing patient care? These are the things, those outcomes, because this is what we have to understand. And I realize this is different, but I talk all the time about driver distraction here. How many people are killed because people put their phone in their hands, they drive distracted, somebody dies from it. But we don't recognize it until it impacts someone. Until then, all of a sudden, you didn't realize it. That's what we're talking about here. Maybe it's a much greater thing, but again, until it impacts us, we ignore it. That's what you're talking about.
Yeah, so let me say the ways that this work impacts me, and I hope will impact others. And that's an invitation. A little goes a long way. It is, as you described, possible to make a tremendous difference with very little resources. We're not talking billions of dollars here. With a few tens of thousands of dollars, you can put solar panels on a healthcare facility and stabilize the power they get so that equipment doesn't get power surges and actually functions longer. And women can turn the lights on when they give birth at night. With a few tens of thousands of dollars, you can install a water system. I'll give you a couple of stories. In San Francisco, Namingo in Uganda, we expanded the water capacity of a clinic to 140,000 liters underground storage that allowed that community to not intermittently run out of water, and to make sure that every patient has clean water at the tap. For the maternity ward, that's a really important thing. In other places, we've done things like improve their medical waste disposal, because that's also a huge problem for these healthcare facilities. They get all of the toxic stuff and contagious stuff, and they need to burn it somewhere. You don't want to have toxic smoke. So we've improved like waste disposal facilities. And it's also, there's some really neat stories of medical equipment repair. There's in Guatemala, in Western Guatemala, we partnered with a hospital where infant warmers, they're like these bulbs, like they're really specially designed, and they keep the babies warm where they're just born. And I know that my son was born 6 weeks early. He was in NICU for 10 days, and he was benefiting from one of those lamps. And in that hospital, all of those bulbs had burnt. And the problem is like you couldn't actually get the spare parts from the manufacturer because those were donated equipment. And there's highly specialized bulbs. You can't order them online when you're in rural Zambia or like rural Guatemala. And what the technicians we partnered with were able to do was actually to like basically MacGyver a system, and the problem that they found is that the healthcare staff had replaced them with normal incandescent bulbs, and those were actually burning the skins of the baby because there's no thermal regulation. And so it's a really ugly situation. It's not just that you don't have a warmer, is that the bulb you've put in actually hurts, creates skin irritation and burns on the babies. And so what they did was like they sourced blue LEDs from the market. The technical staff that we had supported, that we trained with our digital platform, in-person training, basically was able to understand the background of the tech background needed to basically hack together a solution with a few resistors and with blue LED strips that people put on their motorcycles and things like that. And so they were able to actually create a viable solution and put these 11 infant warmers back to being functional. So those are the stories of what we can do. But I would say that what the world needs to realize is that this is a problem at scale, and it's really a problem that's worth solving. And so what Engineers Without Borders USA is trying to do is to get there and to really mobilize the attention of the public behind this issue.
What I liked hearing you say is, for those who might not know MacGyver, you truly dated yourself and not knowing the show was MacGyver, which was great to hear. So for any listener who's young who says, I don't know what MacGyver is, they got to go look at the TV show. But I love what you're saying is it's that ingenuity. You just said what Engineers Without Borders doing, and taking that intersection of engineering with public health and saying how we can do something that's creative. And that's that young mind. That's that investment. It's everything that say you can solve things both technically and sound and critically meet the needs of healthcare. that needs to be done. That's the power. And we might be laughing a little bit, but that's what you said is the engineering part of this, the ingenuity part of this. And I think that's the power of resilience. And I think when you talk about that, I think that's the excitement of what you bring to this, the organization, that you're saying it's also investment that has to be made here, but also says that somebody who says, I want to be a part of this, I want to do something bigger than myself. That's what I love hearing you talk about.
Thanks, Peggy. Yeah, absolutely. There is skepticism about the aid sector, the big aid, the big institutions, the people with expat lifestyles. What we're talking about here is biomedical technicians, people that are like fixing stuff in the village. They're from the village. They repair motorcycles on the side, and then they do these things as well for the healthcare facility locally. This is really grassroots, highly cost efficient, highly scalable when you build digital platforms for training and for them to access the repair manuals they actually need to follow in order to know what they're doing and fix the equipment in a reliable way. But you would be surprised the amount of medical equipment that just sits there unused because it's been donated by the West. That to me is the aid mindset sometimes, like we make the donation and then we think it's over. It's not over. The partnership is a long-term partnership. We need activating the ingenuity of people around the world that are really there voluntarily making a difference. All of the engineering we do is volunteer driven. So yeah, all of your listeners can be involved, frankly, in this work. They can mentor younger folks. They can share their own skills. And obviously they can also donate to the work because again, a few dollars of volunteer coordination and sort of equipment and capacity support in the local context really goes a long way.
So how do they get to understand that? Collaboration is absolutely key to what makes this successful, whether it's on the corporate enterprise level, the engineering individual level, or even those that aren't engineers. And we talked about that the last time. I think we have to expand the mindset of everybody that understands what collaboration with you means.
Yes, yes. And we engineers can't do this work alone either. And what triggered this conversation with you is that I was recently at a global gathering in Rome of organizations that are concerned with this, the state of healthcare facilities around the world. Almost 50% of healthcare facilities are run by faith-based groups that raise money and then provide last mile access to healthcare in really hard to reach places. And the rest is public facilities and then private businesses, but those don't operate in hard to reach places because there's no paying customers. And so we come as a technical support and a technical partner to all of these networks of healthcare facilities. And you wouldn't believe how much the engineering capacity is needed. And so we always find complementary skill sets. We always look to work with locally led organizations where they really understand the dynamics and where you can source parts, who's reliable as a sort of a infrastructure technical partner. And yeah, we cannot go it alone. We've built these networks internationally. We have very clear focus countries where we really understand the details of the context. We engage with national governments because they have a role to play, frankly, in investing in their own infrastructure systems. But all that we do is through partnership, absolutely.
So Boris Martin, CEO of Engineers Without Borders USA, I love it when you come on here. I learn something new every single time. Where can listeners go, corporations, enterprises who want to partner with you, or those that are individuals, where do they go?
Nice. Yeah. So companies that partner with us can have their employees volunteer with us. They can obviously donate towards the work. We're celebrating our 25th anniversary. So we've been inviting people to become monthly donors at $25 a month and to basically help us do this work. But people can join on ewb-usa.org. And this is where you can find all of the opportunities to raise your hand if you want to be part of this effort, make a donation. Again, a little goes a long way. And if you're a company, we have a whole team that's there to support your engagement, see how your employees can volunteer, and how we can have a great impact together.
Boris, thank you again for joining me.
I love being on your show, Peggy. Thanks so much for hosting me.
You're welcome. All right, listeners, that's all the time we have for the show today. Make sure to share and subscribe to our episodes each week. Share your thoughts with me on X at Connected World, or follow me on LinkedIn and continue the conversation there. Please check out our website at connectedworld.com, or our show website at thepeggysmedleyshow.com. This is the Peggy Smedley Show, your voice for our connected world. And remember, with great technology comes great responsibility.